Hi everyone, this is Dr. Marina Mangano, author of The Gift of Healing Hands, going over chapter 3 of this book. So, testing the subconscious body. Already, right off the bat, we need to discuss what is the subconscious body. So, conscious meaning on your surface, something you're aware of. Someone says hi to you, you are aware of the sound, you're aware there's an expected response, maybe there's recognition. Those are all things that you're aware of. The subconscious body is things that you are not choosing to accomplish, choosing to do, but your body is just naturally running them. Things like making your heart beat, making your lungs breathe. While we have control of taking a breath in, thinking about going to sleep, and just those natural systems running themselves. So subconscious meanings under the conscious mind, things that are just naturally happening, or things that maybe like in your habits or your behaviors that you didn't even realize you did. So in the healing sense, when we're working with the physical surface body, a lot of really wonderful interventions are out there and accessible to give you great pain relief, give you good function, but there's this depth that not all practitioners in the healthcare system either have time to get to, it's not in their scope of practice, or they don't believe they have the gifts and the skills to address this with you, or they don't even have the education to realize that underlying aspect could be a component of what you're dealing with. So as I go through all these tiers of the way that I learned techniques, the subconscious body wasn't something that I was introduced to until after chiropractic school. So as I started studying yoga and taking yoga teacher training, there was so much part of the philosophy focused on not necessarily just the movements of yoga and the muscles and the activity aspect. It was the first time that anybody had asked me to sit and ask the body what it wanted to do, ask the mind what it needed. And then I started finding chiropractic techniques and other manual therapy techniques that agreed with that philosophy and understood that while usually, yes, there's always a physical component to discomfort, what is the emotional component, like we discussed in chapter 2? How can we ask the subconscious body what it wants to bring to the surface today, what it wants to heal? And so that's what this chapter introduces, is muscle testing. So I'm really surprised how many people come into my office and joke about some voodoo practitioner up the road that they've been to who muscle tests me. I mean, people who are in creative and intuitive medical careers all get really funny names by their patients, but muscle testing is really becoming more of a surface, more of an entry-level conversation to alternative healthcare providers, anybody in body work. So in this chapter, I really break down my orthopedic and my medical foundation introduction to muscle testing, and then this energetic realm, the metaphysical realm, the subconscious realm, muscle testing. So right away, I studied athletic training in undergraduate school. I played soccer. I was really interested in injuries that I sustained, the care plans of the other athletes around me, and the athletic training department so beautifully set me up to understand anatomy at its deepest level that then I could just go to chiropractic school and breeze through some of the clinic classes because of how in-depth I was taught to learn the anatomy, understand where a muscle starts, where a muscle ends, what it does when it's used, what the body around it does to help that movement or to stabilize, inhibit that movement. And so that foundation alone, when you go into a chiropractic office, a physical therapy clinic, they're not just looking at your muscle like it's this dead thing that you're not using. They are looking at muscle strength in a localized area, but also in the connection, how your brain controls that muscle. So that's where muscle testing began in my education. So we had to learn how to test the glute, how to test the strength of the hamstring, the bicep, the chest muscle. And you will isolate a certain muscle, for example, a bicep to strength, just the biceps brachii, almost make a bicep curl. Ask the patient, don't let me push you down. Don't let me break your bicep curl. The patient will resist and you'll see them flex and contract a muscle. And with a grading scale, 5 out of 5 is the really strong, no pain, does a good job, the brain finds it right away. And so anything underneath that, we grade accordingly. So we had to learn that for really all the major muscles in the body and then a lot of little stabilizing muscles. And I was also then in chiropractic school taught this again. So it was like, oh, I already knew that. I didn't really pay attention to it too much. It didn't lend itself to what I was doing as a student intern and then as almost in like a student residency in chiropractic school. It didn't cross over. There was no reason to use muscle testing. No teacher said during, chiropractic school, you're very focused on learning to adjust. You want to be the best adjuster, quick cruncher, fast cruncher, and efficient adjuster as possible. And then the other things you learned maybe in seminars outside of school or just like with your friends through experience. And there was no really big crossover of why you would adjust after a muscle test or why you would muscle test in conjunction with adjusting. So I discovered that through a mentor of mine during my first job after chiropractic school. Very wonderful sports chiropractor. Went to watch in his office to see how he picked what techniques he wanted, and he utilized a lot of muscle testing. And so why does it matter? Why does muscle testing matter in an orthopedic standpoint? If you've never been to a chiropractor before, you may not really recognize a need for it. Maybe if you're not a lot of pain or you're pretty active and you're successfully active in your movements, going to a chiropractor who utilizes muscle testing is for everyone, because you don't understand that your body is such a powerful computer until you witness the communication of your brain to all these different fine motors and muscle movement patterns of muscle testing. So not every chiropractor is going to utilize this, but I really highly recommend trying to get to a sports kind of chiropractor, a functional chiropractor who incorporates both, because just things you didn't realize you weren't utilizing correctly. If you go to the gym every day and you're doing crunches and core, but your brain cannot even fire some of the deep core muscles of your system, everything you're training is a compensatory movement. Everything you're training is using muscles that are not maybe designed to sustain some of the forces that you're working through, and will eventually lead to dysfunction that can cause pain or injury. So going through a muscle test and asking a provider to help stabilize your core will look like, okay, let's check your rectus abdominis, which is your six-pack muscle, or your transverse abdominis, which is a deep core muscle that supports the spine. By going through those muscle tests, it's a really eye-opening experience to be like, wow, I'm not as strong as I thought, or my body is so different on the left versus the right. I didn't know I had that weakness. Then as you go through care and you get manipulated, maybe chiropractic or just soft tissue treatment, you get to instantaneously see how your body can go from a baseline of the left side's normal, the right side's weak. After care, oh my gosh, the right side feels better. The right side has less pain. My hip flexors are finally firing. So it gives the patient this before and after of what care is doing. It gives the doctor a before and after to educate the patient on how your whole body communicates in conjunction with the nervous system and movement. So, as a student, orthopedic muscle testing just sounds like I need to do this strength test to rule out an injury, a referral that I need to send someone to an orthopedic or the hospital maybe even. But they don't just need to be emergency cases. So trying to get patients who want to be the most optimal version of themselves under this mindset that manual muscle testing or orthopedic muscle testing, another name is a brake muscle test for all of that, should be such a normal part of your treatment. So when it gets weird is the people and the providers who believe in an energetic system in your body, they believe in that something is underneath this conscious body, that subconscious land of emotions and memories and perceptions, that is influencing the strength and the outcome of your surface level movements. Acupuncturists all have an energy system that their philosophy is based off of. Yoga, at its core, yes, there's a lot of wonderful athletic aspects of yoga. That's just one of the 8 branches, the limbs of yoga philosophy. There is so much going on in what they consider the subtle body, meaning not as tangible. It's subtly present under the conscious surface. So the other category of muscle testing that I present in this chapter is what's called indicator muscle testing, or just muscle testing with a different intention, looking for something to come to the surface through a muscle test that may look orthopedic, but we're not looking for orthopedic structure and safety and muscle movement. We are looking for a strong answer to a question or a weak answer to a question. So the provider, as they're going through their body, maybe poking and prodding a little bit, they're looking for a indicator muscle, meaning one very safe, structurally sound muscle that's going to, at its strength, be able to resist the provider. The biceps, I don't use this as an option because there's just so many conflicting variables that could go wrong here. But a lot of providers and things that I've been to, they will use a repetitive muscle test on a bicep. Other providers, you may see them making a ring test, trying to break someone's forefinger and their thumb in a ring form. This was developed by a Japanese cardiologist within that idea that the body can answer a yes or no question, whether you know on the surface the answer or not. So I describe a couple different varieties of this indicator muscle testing. And so if you've never been exposed to this, it can be kind of weird. If you have that skeptical mindset, which is a good thing, I want people to be not skeptical, but I don't want people to just assume and take information without having a personal and a positive physical experience. So when I was introduced to this, it just looked like a lot of what is happening? It looked superhuman, that a doctor could communicate with someone's subconscious, with their brain, to peel out and get the right answers of what was actually bothering them. I studied this for a long time. I worked under somebody who also had a lot of mentors, and so I got a couple fast pass learning opportunities there, but then I was thrown right under the bus and just expected to explain this to patients who maybe have never been to a chiropractor, let alone a weird chiropractor who does things below the surface of the body. So I really fumbled over my explanations of it in the beginning. If I didn't believe that I could actually communicate with their brain, it didn't work. There's this conviction that you believe in yourself, you express the need for this to the patient, really build a safe environment for them, and they will believe in the information and the technique as well. Once you have that two-way trust streak going, that confidence, that safe practice, just these amazing things started happening, these wild healing opportunities that I really couldn't explain, but once you see it work, you can't unsee it. So using indicator muscle testing, there are a lot of ways to do it right, a lot of ways to do it wrong. Unfortunately, because of the variables between each doctor, there's not a lot of reliability in this type of technique. So research is not going to condone it. Health insurance companies are not going to support it because there's just no way to reproduce. This is how you do it for everything in between different techniques of doctors, different careers of medical care physicians. So some ways to do it correctly are in this book. Some ways to look out for, not incorrect, but just ways that if the doctor really wanted to trick you or just use the body to its advantage to make it look like they fixed you, look how strong you are, or yes, your body wants this supplement. I also give a couple cues of things to look out for that if I really wanted to, I could mislead you and do a good job at muscle testing after my care to show you the progress. And I really just want to focus on the highlights and the positive aspects of this care and not be a skeptic, not be a critic, but that's the mindset that I went into this type of care with. I was not going to take advice from someone that I didn't trust, someone that I felt was taking advantage of me. I needed to have that physical, personal experience. I watched my body shed years of surgeries and fear-based movements, using things like this. Some of the trapped emotions in chapter 2 we only found because we had access to muscle testing. So while I don't utilize so much an indicator muscle testing anymore in my practice, I follow more just intuition and conversation with the patient. I definitely use my orthopedic muscle testing style of care. Any person that comes in, for example, that has hip pain, I need to find out which muscles the brain is not talking to, which muscles cannot fire because the joint may be in an improper position. You may be utilizing 50% of the correct muscles in your hip movement, and the only way that I would know that, palpation is very important. Touching and figuring out the tone and the quality of the tissue is very important, but you cannot understand the neurology of any joint in the body without adding resistance, adding motion, and that is what I think is so important about muscle testing for the new student, the new doctor, and just having this basic level of information for yourself. So when you do call around to chiropractors, physical therapists, you have this loaded information to kind of not make demands, but just say, this is the type of care I expect. This is the quality of care that I'm hoping for. Can your office provide this? Or if not, please recommend me to someone in the area who does soft tissue work, who does manual muscle testing. And then usually you get there, you start very normal, you start very orthopedic, and then you peel off the layers. And that's when I really try to get into some of the more subconscious healing aspects of indicator muscle testing. So there's a lot of anatomy in this chapter, a lot of neurology, so bear with me on it. But I think it's so important to have that high level bar of common knowledge. So going through finding your own self-study on a couple of the topics, I also discuss, what is a neurological response in a muscle test? How does the body say yes? How does the body say no without verbal communication on the surface? So there's some really wonderful stories in here as well, and I hope that you enjoy it. Look forward to talking about chapter 4 next. Have a great day.